guys, we are occupational therapy students from Milligan College in Johnson City, Tennessee, and we are here today to talk about sleep and rest in adolescents and in young adults and the importance of it. Adolescents and young adults, that includes ages around 15 to 25, give or take. On average, young people, adolescents, get around 7 to 7.5 hours of sleep, and actually studies show that you should be getting about 9 to 9.5 hours of sleep. Lack of sleep, it affects many areas of life. This includes mood, behavior, cognition, academic performance, and work performance, as well as overall health and wellness. Young people typically spend a lot of times on their screens, whether it's a cell phone, texting on social media, a laptop watching Netflix, or a TV playing video games. This overexposure to blue light has been found to suppress melatonin levels and affect circadian rhythms twice the amount of other lighting. Lack of sleep is also linked to depression as well as other health problems.
So as you can see, it's really important to sleep and get good quality sleep. So I'm going to talk about some simple solutions and techniques that you can incorporate in your life to get the amount of sleep that you need and also the quality of sleep that you need. So it's important to establish a regular sleep schedule, also incorporating the hours that you need, but also keeping that schedule for the weekends and not oversleeping or going to bed later, but trying to stay on that schedule that you have during the weekday, and that'll really help your quality of sleep and maintain that regular schedule. Also, it's important to remain active during the day and try to unwind at night so that you're not doing a lot of things during the afternoon and staying awake, and that way it'll be easier for you to fall asleep when you are ready to go to sleep. Be conscious of your caffeine intake and also alcohol, and don't consume those things before bed. Like I said, try to go to bed around the same time every night. That's really important. And those who are working the night shift or studying really late, these people are particularly at risk for sleep problems. So some solutions to that and some adaptations: turn off overhead light and use lamps and warmer lighting instead of the blue light. This will help with your attention and being able to fall asleep when you're ready. Something that you can purchase is blue light filtering glasses. When you're looking at a screen, that'll filter those blue lights. And iPhones have a night shift mode that you can turn that on when you're ready for bed, and that decreases the blue light. Young adults and adolescents are exposed to a lot of screen time, so this is particularly important because blue light is good during the day because that can increase your alertness and your concentration, but it can be detrimental and keep you up at night. And although you can fall asleep, the quality of sleep is not as good. So they recommend at least 30 minutes before bedtime shutting off all your screens, maybe exchanging that for a book instead. And some research shows that even turning off the blue lights 2 to 3 hours before bed will really increase the quality of sleep. So those are just some options. We also have some simpler options like meditation, yoga, a hot shower or bath before bed. Like I said, reading a book or something relaxing to kind of help you unwind to go to sleep, and a sound machine and a night mask. And we're actually going to post a link below that gives some of these relaxation techniques, so you guys have that resource. If you guys would also like to learn about adulthood, sleep and rest techniques, we will link that video below also. Thanks.